we're going to Southbourne at the gas station for a female with a laceration to the head. Unknown how she acquired this laceration.
PD requested him.
PD is on scene with a code 4, and 6249 just made the scene. Oh my God, I have to pee. Why don't you take Earhart? It's gonna be smoother if we go down Earhart. I mean, you do what you want, Ted. I just don't want to bounce down Tulane Avenue when I gotta pee.
Okay. There she is.
I gotta put my raincoat on.
3220 on scene.
So as we pull up, NOPD's on scene, our sprint medic's on scene, our supervisor's on scene. They already have her head bandaged.
It's cracked open. You can see her skull from here to here.
Okay.
Stand up for me.
Okay.
Come on. Come on. Okay, right there. Sit down. Lean back. There you go.
We are baby. Why are you saying sorry?
Come to find out that she's a lady of the night, and one of her Johns wanted his money back, and he grabbed her by the head and was pounding her head.
All right, baby. Oh, sit up, baby. Sit up. Let me see.
Yeah, me, God.
I thought she had been hit almost like with an axe. You could see down into her head. First time I've seen anything like that. I mean, it was just unbelievable.
Pick your head up for me. Just a little. I know.
We needed to get her to the hospital ASAP because we couldn't tell what other injuries she had. Didn't know if she had a skull fracture, brain injury, whatever. So she definitely needed to get seen by a doctor quick.
So what happened, my baby?
Okay, for the $20, and then he wanted to take his money back, and it was over with. And then he just wanted to fight.
Did he hit you with something? Did he
I
hit your head
slammed
on the
on the
ground?
ground.
On the ground? Okay. New Orleans EMS University.
Just slammed me at my
Okay.
University, go ahead.
Hey, I'm in Rusty with a 55-year-old female. She was assaulted tonight. She was slammed to the ground on her head. She has approximately a 6-inch laceration that is open and down to the skull with adipose tissue. I'll be to your facility in 2. There's nothing for you to be sorry about, okay? Just because of your line of work and what you have to do to survive does not mean this should happen to you.
He was wrong.
He was absolutely wrong. You're gonna be all right. You're gonna be all right.
Okay, thank you.
Uh-huh.
Appreciate it.
It's always hard when someone is in a situation like this because it really does break your heart. And all you can do is just be there for them. This is what I'm here for, my baby. I am here to make sure that you're
God
okay.
for you. Thank God for you.
Man, I tell you what, that head was split, huh?
Jeez, was it? I really do feel bad for her. I mean, do I think she needs to get off the streets? Absolutely. And she said the same thing. But just because she's out here doing what she's doing is not a reason
No.
for somebody to do that to her.
Absolutely not.
Do you need the police or paramedics?
City of New Orleans 911, what's the address of the emergency?
I need an ambulance in emergency real bad, family. I'm on the interstate, man. We slammed into the railing.
So y'all had an accident?
We slammed it to the side, and I can't see, ma'am.
Okay, ma'am, stay with me, okay?
I'm trying.
Ma'am, I just sent a ticket to your phone so you can give me your location. Once you click that, I'll be able to see exactly where you guys are.
My phone is so bloody, ma'am. Oh, Jesus. We need help, man.
Help is on the way, ma'am, okay? They're on their way.
All right, so we're going to a wreck on the interstate. Hopefully, no one's injured.
Dog.
Wrecks up here can be pretty bad, man.
Dude, when it's raining.
And it's raining too.
I hope it ain't too bad.
I guess it's gonna be on that side.
Well, it's gonna be, it might be on that little loop right there. Oh yeah, you can see it. I know we're gonna get to that, pal.
You can show us an area, we see it. It's on the little flyover. Just give us a little delay. We're trying to figure out the best way to access it.
Yeah, well, just be advised. You think her head went through the windshield?
Oh, whoa. Her head went through the windshield?
You gonna back up the ramp or want me to get out and back it?
Me and Joe, we responded to a call for an SUV that just hit a guardrail. And they're telling me that the patient head went through this windshield. I'm thinking, does this lady have some type of head fracture? So Joe and I need to snap to it.
We're gonna have to walk up the on-ramp.
Hey, all right, what they wearing seatbelts? Say, fam, you was wearing seatbelt?
What's up? What's up? Oh, look.
She's bleeding real bad.
All right. 50 contact, trauma activation.
We got you, baby. We got you, love.
Thank you. Are you able to stand up?
Oh, yeah.
Any neck or back pain? Lay that stretcher down. I see that, brother. We got her, okay? Did you get knocked out?
Look,
Everybody
baby,
else
look,
okay?
Look. We got to put this on your neck,
Let's
love.
take this jacket off. Give me this phone.
Take the jacket off. We got you, sweetheart.
Here.
We got you, love. It's gonna be all right. Let's just drop this jacket. You gotta lower your head, hold it out.
All right, let's get her on the stretcher.
Come on, love, come on, baby, we got you.
You just stand there and I'm gonna turn the stretcher towards you.
We got you, baby.
The patient's talking to me, so that's a good sign. But she has a major laceration to her forehead. There's a lot of blood, and so it's really hard to tell what kind of injuries she really has at this point.
All right, my name's Joe and that's Titus, okay? And we're gonna take good care of you. What was your name again? Danielle? I can remember that because that's my sister's name. I know you're scared, but everything's gonna be all right? We got you.
All right, Joe, how you been, dog? I'm gonna go do it.
Yeah. You having any trouble breathing? No? Yeah, we do. Here you go.
All right, baby.
Legs and arms.
You said, did you pass out at all? No? Nice deep breath. I got you. All right, cool. Let's get it.
If you'll bandage that, I'm gonna start an IV. Here's your curlets. Let me see this arm.
Hey, hand me a head block. I got you, baby.
Hey, Danielle, just keep talking to me, all right?
Keep talking, D. We about to go to the hospital. You got it? Come on.
All right, big stick.
Good job, D. You're doing good, baby. Now, keep talking. How old is your kid, baby? 4 years old? I got a little 5-year-old too, love. We want to keep her talking because we want to monitor her alert status. And this lady wants to live. You can see it in her face, the way she's talking and the way she's calm. She's telling us everything that we need to know. And the more information that we have, the better chance we could do to save her life.
How old?
Nah, we good. Should be good. Thank y'all, fella.
Trauma activation.
It takes a lot of force to go through a windshield, so I'm really concerned about what's going on inside of her skull. I'm thinking I need to get this lady to the trauma center as quickly as I can because at this point she needed a CAT scan like yesterday.
Try to get an IV on you before we get there, all right? You left your veins at home, huh? Yeah, you are hard to get. If you'd have knew all this was gonna happen, you'd have brought them with you, huh? I got you laughing, that's what I want. Keep laughing for me, okay? You're gonna be all right.
Dude, that lady head was leaking,
Man.
Dude, I've been doing this 14 years. That's a lot of blood. I ain't seen that blood in a long time, bro.
Shirt was saturated, man. She's lucky to be alive, man. Her head went completely through that windshield, man.
Completely through. You know when you first pull up, you're supposed to look for the spider web?
Yeah,
it was no spider web. It was like a straight hole.
That's crazy. That lac went all the way across her forehead.
Driving her to the hospital, bro, I heard her laughing. And what you was telling her?
Man, I told her she left her veins at home, man, because she had none. I made her laugh, though, man. That made me feel good. That moment.
So you telling me, man, a lady head split open, you told her a corny-ass joke, but at least you made her laugh.
You know what? Bro. Corny or not, it served its purpose.
A lot of times you get these people with head injuries and they're like, I just want to go to sleep. I'm so tired. No, I'm gonna keep you talking to me. My goal for that patient was to make her laugh. She laughed, mission accomplished. I think she's gonna be all right. I think it's more of a superficial laceration. It's all gonna depend on what the CT shows.
You know what? You did your thing, man. For her to still be living, that's a good job, baby boy.
Do what I do.
You ready for the next one?
I'm ready for the next one. You ready?
Let's get it
Gonna
in.
put this monitor up, and we're gonna go.
All right, for sure.
City of New Orleans 911. What's your emergency?
We have someone choking. We're giving him the Heimlich. We need someone out here immediately.
Okay, do we know what he's choking on?
He's a beast.
Tell me, is he able to breathe at all?
No, he's losing consciousness. He's not able to stand up anymore.
All right, I have fire and EMS en route to you, okay?
He's blue, ma'am. He's blue. He's foaming at the mouth and he's blue.
Can you turn him on his side?
Ma'am, we need help immediately.
Listen to me. We need to do the Heimlich maneuver again, ma'am. You're gonna put your arms around his waist and make a fist for me.
Arms around his waist.
Grab it with the other hand above the belly button. Jerk really hard, and it's a quick motion up into his stomach.
Up into his stomach.
And keep doing that until he can breathe, talk, or cry.
As hard as you can. As hard as you can.
You're gonna have to keep going until they arrive.
Please, please, please. Ma'am, he's blue. He's blue.
All right, ma'am, they're en route to you.
I am headed to a person that was initially choking on a piece of meat and then went unresponsive and stopped breathing. So this sounds like a full airway obstruction, which can very rapidly then progress into respiratory and cardiac arrest. If it is a full obstruction, especially with food, we can try to, pull it out of their throat, see if we can ventilate them to the point where they start responding again and breathing.
This is one of those true life or death moments where every second matters because there are two things that are happening. Number one, he's not getting any oxygen to his brain and to his organs. And number two, his heart's gonna stop.
Patient blue, unresponsive.
Right here? Oh, yes, he sure is. Okay, we're gonna help him. On scene. No, don't do the Heimlich. You can stop, don't do the Heimlich. We're gonna get him.
Once a patient reaches the level of being unresponsive, they cannot support themselves in an upright position, and so the Heimlich maneuver is not appropriate anymore for this patient.
Do y'all know what he's choking on? Hurry up and get the stretcher.
Get out of the way! Hey, help him get him on the stretcher, let's go!
Get everything off, get his legs.
Hold on, guys. I got it. Everyone relax. Okay.
You ready?
Yeah, what?
He's agonal right now.
I am responding to a call for a male that is choking on a piece of steak. While choking, this patient started to panic, which is how he maybe ended up outside. He is unresponsive, purple from head to toe, and barely breathing. This guy has a full airway obstruction.
Grab the airway roll if you can get the McGills.
All right, buddy. We got you, man.
I know. We got it.
The first thing that I do is grab our video laryngoscope and the McGill forceps. So in being able to visualize what is in his throat, I can come in with the forceps, grab it, and pull it out manually.
Oh, let go, buddy. Let go. There we go. Hold on. Okay. Oh, good. Sit up.
Hey, man.
He's still got a large chunk of it in there.
Spit.
There we go.
Can you speak to us? Tell us her name. There you go. All right.
Can we try to put that oxygen mask on you for a minute, bud? All right. Just take some deep breaths for now. And you're also going to feel some swelling and some things like that. So don't want you to keep coughing if we can't get anything up, all right?
He's able to talk to us, but he doesn't really know what happened. He doesn't realize he just almost died.
Oh, you were blue,
You were purple, yeah.
So good.
I would, if this is what he's gonna do.
I'm just gonna go put like...
Yeah, I would go to the hospital just because he's gonna have some airway swelling. They may wanna just tube him. Is that your family out there, buddy? I'm gonna go let them know just since they're so freaked.
What?
Hey guys, so we have the piece out. He's up. He's breathing on his own, okay? We're gonna, of course, transport him to the hospital because there is still a piece in there, but he is up, he's breathing on his own, and he's aware. Okay. Yeah, you can look at him for a second. They just want to look at him for a second, but we still have a lot to do, okay?
His outcome should be phenomenal. Without our intervention, this person could have very much been deceased.
6249, you can show me clear. So 3244, code 3 to university with one patient. Yeah, that was a bad one. That dude almost died in front of him. I just pulled a whole piece of steak out your mouth.
That's a sexy fate. That's a sexy.
That dude's gotta be so thankful.
Here you have a 51-year-old male with flu-like symptoms.
Going an old guy with flu-like symptoms on Turo Street.
Is Turo up here? Or?
Turo's actually a couple streets over,
Okay,
but North Robertson and Villery's up here.
Paige is seemingly real innocent. I'm definitely not. I think Paige has been here about 8 months. I'd say we're opposites of, I don't know. I've only worked with her a couple times, so we're still kind of getting in a groove of feeling each other out and getting that good flow going.
Come hurry up before we all get a wet ass.
All right, who are we here for?
Feeling bad? What's going on, brother? What's bothering you? Everything? Well, let's get you to the front door so we get you on a stretcher.
We got the call for flu-like symptoms. I noticed she's struggling to breathe a little bit. It didn't look like a flu to me.
So prostate cancer, gallstones, kidney stones, what else we got?
So you been feeling bad all day?
Yeah.
Hey, Gavin, we tacky. All right, sir, slow, deep breaths for me, okay?
You got heart problems, bro?
No.
I might have to give you some medicine. Slow your heart down. It's gonna feel like you're on an elevator and it drops. It's gonna make you feel funny.
His heart rate was like 180 to 200. We gave him medicine called adenosine to try and break that rhythm and bring him down to a normal rate.
We still hadn't budged. We still way up there. You want the other 12, or is it pads time?
I'm gonna call UH.
Okay. You ready to go?
Yeah.
Time to roll.
New Orleans EMS University. I'm bringing you a 52-year-old male, short of breath, heart rate 180 SVT. No change with 6 and 12 milligrams of adenosine. I'm putting the pads on him because his pressure's dropping. He didn't respond to the adenosine.
Once the medicine didn't work, we go to cardioversion. We place the pads on him, set it at 50 joules. The electricity about to hit him will slow that heart rate down.
All right, Mr. Joseph, I gotta get you out of that heart rate, okay? So I'm gonna have to hit you with a little bit of electricity. It's gonna feel like somebody punched you in your chest, all right? Okay? Easy. Easy. No change. Got one cardioversion with 50 joules, no change.
You go ahead and shock him with 100 joules.
Simple. Doc wants one more, okay?
Oh, Lord, no.
I know. One more.
No!
Easy.
Oh, Lord, no more.
That's it. That's all the doc asked for. Absolutely no change with 100.
Okay, just bring him on in.
It's not easy when you know you're hurting the patient. They're already in pain. You don't want to make anything worse, but doctor's orders, and I had to do what was in his best interest.
No break, cardioverted twice.
You ready?
Yep, ready.
He ended up having sepsis, which is basically if you have cancer, you tend to be really prone to infection. Your immune system's down, and when that infection gets too bad for your body to control, it can actually cause what's called sepsis, which it's a pretty big problem.
We have a male patient, approximately 9 years old, having difficulty breathing. The caller informed us that the child does have asthma. Please respond.
9-year-old kid, difficulty breathing. Had a treatment, it's not working.
Being a dad, calls with children, kind of tends to tug at your heart a little bit. You tend to relate more personally.
Let's go say hi to the little guy before I'll see. Hey, big guy, what's up? You okay? You scared? What are you scared of? Yeah, that's from breathing so fast. Take it easy. You'll be all right. Let's take this out your mouth. I'm gonna listen to you breathing, okay, big guy? Yeah? You have asthma? How old are you, Bubba? 9. Man, you look like you're 10 at least. I thought you were like 24. Take a nice, easy, deep breath. Slow your breathing down. There you go. Now, when you take a deep breath, does it hurt pretty bad right in there? Where's it hurt? Point to it for me. Right there. You been coughing?
Every time I cough, I get a headache.
You get a headache? Well, you gotta stop that coughing then. You don't want no headache, do you? The thing he's saying is when he takes a nice deep breath, he's having some chest pain. Now, it could be
Pneumonia.
Does he have a history of pneumonia?
Before he did it.
Okay, has he had a fever?
Yeah.
Okay.
Asthma in itself, if left untreated, can be dangerous. Now we learn he has a history of pneumonia. Everything's a little more serious. Our main goal at this point in time is to keep him calm and let him know that everything's gonna be okay. Is that pain feeling a little better in your chest? No? Put you back on this stuff again here. You still scared? I ain't gonna do nothing to hurt you, all right? No needles, no nothing. How about that? Sound like a plan? All right. You ever seen a picture of your heart before? You want to? Right there? That's your heartbeat. Each time it beats, this big line goes. Okay? You want a picture of that? When I'm treating kids, I tend to treat them as my own. So I take all kids very serious and personal. You wanna give me a bump? All right. You kind of missed, but I'm gonna let you slide because you don't feel good. You making good grades? Promise? All right, I'm gonna keep track of you. You don't smoke, right? You don't drink alcohol?
No.
You don't do drugs? You better never start. I'm proud of you, kid. Grandma, you do a good job. Treating kids can be very rewarding. To see him start to smile toward the end is a tremendous feeling. I think this guy is gonna be just fine with a little rest and some breathing treatments. My man, what you got there? Your heart? You're holding your heart in your hand? He's holding his heart in his hand? That's just crazy. Hang on to that now.
City of New Orleans 911, what's the emergency?
My daughter has been stabbed in the chest by this bitch.
Okay, yes, ma'am.
And I need the ambulance ASAP.
Okay.
I'm about to die. My daughter is bleeding in
Okay.
the chest.
I have EMS en route. Okay, ma'am. Where's the suspect now?
The suspect's still outside. This bitch is a psychotic. Everybody in the apartment have a problem with him. And we still having a problem.
Okay, yes, ma'am.
My daughter said she's about to pass out. We need you to bring her to the hospital.
All right, everything is coming to you. Let me know if she passes out.
We are going to an unknown aged female that has been stabbed. Apparently the police have no units available and they haven't dispatched this yet. Gonna have to see what the call notes say as far as where the perpetrator is located to make a decision on whether or not we can enter the scene without them, which isn't very likely. I don't like doing that. I don't like putting crews at risk. For real, assault cases and domestic violence rates is like popping, and it's like all stabbing.
36-1-36-249.
Go ahead.
We're getting flag down right now.
All right, I'm coming. I'll be there with y'all. Just if anything seems, you know, hairy, just pull off before y'all get out.
Just saying if the perp is gone.
10-4. So the unit was in the area waiting on police to secure the scene, but they got flagged down either by the patient or by the patient's family. But their notes on their computer say that the perpetrator is gone. Stabbed in the chest? Are you having any problems breathing? She's stabbed in the chest. She's coming down the stairs now.
Are you having any shortness of breath at the moment?
It was just the one time? Okay, but the one time in the chest? Are you having any problems breathing? Yeah? Go ahead and scoot your butt back, baby. We're gonna do a lot of things really quickly, okay?
Right now, I'm responding to a female that just got stabbed. The first thing we want to do is a trauma assessment. You have so many big, major blood vessels in your chest, and if you hit one of those, you can bleed into your chest and die very quickly. On that side, right? Where? Okay, yeah, on that arm over there, right? Okay, I'm gonna start an IV on you right here, okay? But I'm gonna let you know when it happens, okay?
Yeah, I just had it.
All right, little pinch right here, okay? Don't move, 1, 2, 3. You said you do feel like you're having problems breathing? You feel like it hurts to take a deep breath? Okay. Gonna listen to your lung sounds, okay? The absence of external bleeding gives a false sense of security. You should always take it with 100% seriousness and just assume that it's penetrated through the chest cavity and done damage. Your oxygen level is 100%, okay?
I've been drinking a little bit.
Okay. Good thing is you're not bleeding much and your oxygen level is 100%, which usually means, you know.
I'm trying to control my breathing.
Good, okay, good. Even though she is a stable patient that's been stabbed, because we want to take so seriously, our goal is still going to be to get her to the trauma center as quickly as possible to make sure that she is not turning from a stable patient to a critical patient. 6249, you can show 3223, code 3 to the trauma center, times 1. The reality is, it's like where she stabbed her at, she very well, she could have hit, you know, her aorta, she could have, you know, infiltrated, you know, like her chest cavity all the way to where she had blood and air in her lungs and caused her a collapsed lung, but she definitely got her in an area that, you know, had she gone deep enough or the knife been big enough, can of course be fatal at any time.
Good evening, New Orleans 911. What's your emergency?
Possible overdose. I just need an ambulance.
All right, stay with me so I can get some information. Is she breathing?
Yes. She's just very disorientated, doesn't know where she's at or what's going on.
So she's not completely alert?
No.
All right, I'm sending paramedics to help you now.
A 21-year-old female possibly overdosing at the location. Not alert. Color change is pale. They say she is breathing normally.
So we're headed to a 21-year-old female. We're hearing that she's not alert.
21 seems young to me to be like get into like hardcore drugs.
Oh yeah.
I mean, it's possible.
Especially like the rise in overdoses from everybody staying home.
It really could be anything.
Yeah.
We're just gonna have to figure it out when we get there.
Hopeful that she is breathing adequately on her own.
Three, 2, 4. In the area looking.
Are y'all sure about anything of drugs?
Yeah, I have the pill there.
Okay, because all of these are empty.
Yeah.
How many of those did you take? Can you tell me? You don't know?
The friends actually bring out 3 bottles of empty medications that she could have possibly taken. They're pretty much prescribed sleeping medications. So she could be like sleepy and groggy right now, but she can deteriorate in the future if she took them recently and they're still just working their way through her system.
Take some deep breaths, okay, Mom? That's okay. Try to take some deep breaths in through your nose, okay?
It's super important to try and figure out how much of these you took, okay? How many? Tonight. She might be awake and breathing now, but that can go downhill in a heartbeat. We need to try to figure out how much did she take of this.
One of those was filled in like October and the other one's December, so they couldn't have had like too many in them.
Because we have no idea, we have to err on the side of caution and just suspect that she took a lot. We're gonna get you some help, all right, Muffin?
Our patient, she's in a bad place. She's very upset. She's very emotional. We're just trying to keep her calm.
It's okay. Try and calm down for me, okay? I think you just took a little bit too much of your medications tonight, okay?
Time is of the essence to get her to the hospital.
All right, you think you can walk for us, baby?
If she starts to decline, they have what they need to combat all of that.
Here, love, let me see this. I'm so sorry. We're gonna get it warm in here, okay?
How am I here?
You called your friend and they called the 911, okay? We're gonna bring you to the hospital.
Was I dead?
No, babe, you weren't. You got a lot of good people taking care of you, though.
But was I dead?
No, babe.
All right, my babe. Got a mask for you, okay?
All right, you ready?
Yeah. Have you been dealing with some tough times recently? Yeah. Yeah. How many did you take tonight? 30? In my experience in EMS, the people who are just right on the edge, a lot of time they'll make one last cry for help, and I think she did that tonight. Whatever you're going through, whatever kind of help you need, they can get you that help. You don't ever have to feel like you have to take too much of your medicines to try to make the pain go away in any kind of way.
Yeah.
It's all right.
Safe, be strong. Let's do this.
Get that stretcher in here.
You're gonna bleed to death.
Grab the knife. Grab the knife.
You know, they're not dead. I can work with that.